processes and infrastructure in healthcare have not changed in 20 or 30 years. So they're just really antiquated. But,
why is that?
I think what happens in healthcare is whenever there's a platform, people want to build off the same platform. So in healthcare, the first tech solutions they were getting were truly electronic medical records. But if you ever have a physician friend, ask them about their experience with electronic medical records. It's just a series of drop-down screens, which are entirely annoying. And so, the problem is people can't be innovative. They try to recreate or copy what's out there. But if the stuff out there isn't good, we should recreate the entire wheel. And in every other sector in the world, that's done at a rapid pace. And in healthcare, it just isn't.
Yeah, but why is it not in healthcare? Because, in the same time period, every other industry I could think of has been adapting, advancing. They've been atomizing the technology, taking these giant platforms and breaking them down to pieces where companies specialize in doing them very elegantly. If you're talking about kind of really outdated tech across the board, why has this industry had the brakes on it?
Yeah, so I would say that there's a couple factors. One is that healthcare is very niche. And so the sector of healthcare you're talking about could be very dissimilar from another. And being niche is also very cliquish. So you're actually in the know or in the group or in the A crowd is a big feat. The other part is that the really bright people that innovate other industries just don't, as a general, they don't have the reference or the framework to understand the workflows for your average healthcare provider. And so you could have a nice solution, but if you don't understand what it's like in the daily life for that healthcare provider, and you're not addressing the needs for the workflow, then you're at a disadvantage. And we see that a lot. There's a few competitors of mine that are trying to emerge, and their technology is interesting, but it doesn't handle what the flow is for those staff members every day.
But in every other industry, as a VC, I see someone jump out of the industry. They were not in a technological industry at its core. They realized something was weird, right? They're using Uber on their cell phone for their personal life, and then they're going into these extremely outdated technologies.
Yeah.
And they show up and they pitch us. Why does that not happen more rapidly in healthcare, right? Something so mission critical. There's so many smart people around it.
Yeah.
It's bizarre to me.
It's a great question. I couldn't give you a clear-cut answer. I mean, the reality is, I think, as a general rule, if you just take the life cycle of a physician, they're in school all the way through college. Right. If they're lucky, they have a year off after college where they blow off some steam. Then they jump right back into medical school. Then they jump into their residency. Then they jump into their fellowship program. Then they're trying to join a practice. And from the moment they hit med school for the next 10 to 12 years, before they even start treating their own patients with full autonomy, everyone from every sector of their life is asking them to buy something. They're always being sold. And so when new innovative technology comes out, it's being thrown in a bucket with all these vendors that have been after something from doctors from day one. And a lot of the times they just can't embrace the concept of change. We had some of those headwinds early on when we started Margin, and I made a decision not to be a marketing company. I wanted to pull customers to me by just offering great service and letting their friends talk to them about us. And so we've grown really organically just from word of mouth. But I think it's that mindset of physicians that they're always being sold. And if you're always being sold, you're going to be resistant to hear anything new.